I am Artemis Teagan, and I am the owner and director of the Artemis Center for Family Therapy. I am happy to have two of my colleagues here today, Robin Kim and Veronica Davies. We're going to be answering questions today about how we use mindfulness in clinical practice, in particular with children, adolescents, and families. How can you apply mindfulness with a child who's anxious most of the time? And this might be a good question for you, Robin. Maybe you can give us an example of what you might do with a very young child.
Okay, so like a child around 5 to 7, around that age. I actually did have a client who had a lot of anxiety about a lot of different situations, whether they were social or in school or things with family or just
generalized anxiety disorder.
Yes, very generalized anxiety. And this would distract her from being able to do work at school and have appropriate interactions with people. And so one of the things we did was, it's like a guided visualization, but it's also getting people to pay attention to what they're doing. And I have a little activity that we can do. Would you be willing to? Okay. So here's a piece of paper.
Okay.
And this is how I would say it to the actual child that I'm working with. Choose a pen that you can use to draw something that you really like and something that makes you feel good and comfortable and safe. And you can choose more than one color if you want. So then what we're going to do is, just for a second, close your eyes.
Okay.
And just imagine yourself in your safe place, whatever that is. If it's your bed at home, or if it's a garden, or if it's a beach, or someplace near the water, just imagine yourself there, okay? And then imagine what it would feel like to open your eyes and see that right in front of you, and to walk around that place. What do you feel? What do you hear? What do you smell? And just kind of allow yourself in your mind to walk along a path, or if the safe place is someplace like in your home, imagine yourself walking through your home and sitting down in a quiet place and just being there. And if your mind starts to wander, that's okay. Just notice where your mind is going and bring it gently back to your safe place. And then I want you to take one of your hands and put it over your eyes, just gently and softly. And then when you're ready, I want you to slowly open your eyes and then take your hand away and then draw your safe place on your piece of paper. Okay? And you can start with whatever it is that stands out the most to you, and pay attention to the lines and the colors and how you feel as you're drawing, and as you're remembering what you walked through or where you lay. Remember what it smelled like. And try to put as much of that detail into your drawing as you can. And so as the child is drawing, sometimes I'll ask questions about the detail. And so I get them to pay attention to the details so they can bring their focus to what is happening right now, what they're thinking about right now, and something that feels good to them right now. So I notice you have a lot of candles. Those are really pretty.
Yeah. They're my secret place.
Sometimes it's good to have a secret, huh? That nobody else knows. I like that. I like that you have a secret. Can you tell me about that right there?
That's a pot. It's a pot. It's cooking dinner.
Oh. This is a whole story right here.
Yep.
Yeah. How do you feel when you're drawing that pot?
Cozy.
Cozy. That's nice. Can you feel cozy in your body?
Mm-hmm.
Yeah? Where do you feel that?
Right here.
Right by your heart.
Mm-hmm.
It's a nice feeling, huh? As you want. So when we're done, I usually say, you know what, this is such a great drawing and a great reminder of your safe place. I want you to take it home with you. And can you tape it to your wall or put it right by your pillow? So when you're having a hard time falling asleep or you're having a hard time doing your homework, maybe you can take a minute and just stop and look at your picture that you drew of your safe place. And it will remind you of all the things that you really like right now. And then you can get calm and focused, and then you can do whatever else you need to do.
Okay.
Okay?
Nice.
And when I use those kinds of interventions with this particular child, she actually she went up to straight A's in school. So seeing that improvement really bolstered her self-esteem. It really bolstered her confidence. She was actually more calm about going into test-taking times, more calm about doing homework, so she was able to perform better.
Excellent.
Yeah.